Dr. Clark. Thank you so much, Kara and Dr. Calkins. I'm really delighted to be able to kick off our discussion this morning. So welcome to the Endowed Laura Mann Integrative Healthcare Lecture Series and Family Medicine Grand Rounds. This is actually our 10th year offering these lectures, which are inspired by Laura Mann, who was a nurse midwife who integrated Western medicine with complementary and integrative therapies. Despite her untimely death, Laura's vision is alive through this series, bringing distinguished leaders in integrative medicine to the University of Vermont to share best practices, research, and innovations in integrative health and medicine. The series is hosted by UVM Integrative Health and most often occurs during Family Medicine Grand Rounds. It is my pleasure to introduce Dr. Kavitha Reddy. Dr. Reddy is the Associate Director of Employee Whole Health in the Veterans Health Administration Office of Patient-Centered Care and Cultural Transformation. She is also an emergency medicine and integrative medicine physician at the Veterans Administration St. Louis Healthcare System in Missouri, and an assistant professor in emergency medicine at the Washington University School of Medicine. Today, she will be presenting on whole health system of care, supporting the health, well-being, and resiliency of employees. As many of you know, I am particularly passionate about the well-being of our employees and our community. The last 2 years have certainly impacted our physical, mental, and social health and well-being. I think important talks like this really help us consider how we can create a culture of wellness, support our most valuable assets at UVM and UVMMC, and that is all of you. So welcome, Dr. Reddy. We are delighted to have you with us this morning.
Thank you so much for that warm welcome. And I am also really excited to be with all of you. I know this team has told me we have several residents, students, family practice world. We have people from employee well-being, integrative medicine. So I'm just honestly really thrilled to be with you because the presentation today will really cover a lot of ground. But in particular, this is where we start to create a culture of well-being, when we bring all of these key people together, when you in your early careers start to understand how this fits into your own job crafting and your own satisfaction and fulfillment over time. And for those of you that have been leaders at this institution and in this work, hopefully it will spark new ideas or creative thoughts, or maybe even a sense of, we're doing that. How do we scale it up and make it bigger? So hopefully this will serve as inspiration, validation, and create some camaraderie amongst all of us in the healthcare world. As the introduction said, I'm an emergency medicine physician. I'll share some personal stories throughout this presentation as well. Just want to make sure you guys can still see my slides. Everything going okay over there? All right, great. So throughout this next hour, I'm going to try to leave about 5-10 minutes at the end. We're going to cover a few different things. My objective in talking with you this morning is hopefully a deeper understanding of how we're taking the whole health model, which really embodies and tries to implement the concepts of integrative medicine and health, and how we apply that to employees in VA now, and even our future vision of what that will look like. I want to talk to you a little bit about early outcomes from the whole health work we've been doing, both for the veterans we care for and for the employees. And keep in mind, we have close to 400,000 employees in VA of all different walks of life, right? So when we talk about caring for employees, it's a vast job that requires a lot of partnership. And then the bulk of this presentation is really on pulling away practical tips for creating and supporting a culture of well-being. And then I want to spend a little bit of time on coaching because it's really a profound way, both in the healthcare system and for employees, that we can think about crafting our careers and jobs. And so what you'll see here in my objectives is I don't specifically say we're here to tackle or solve burnout. But I can't have this talk without saying out loud, we know that this is a big issue within the healthcare world. We know many healthcare workers are reevaluating, their commitment and their values and their purpose and connection to healthcare. So you'll hear me talk about that throughout the talk, but really what we're trying to look at is how do we get ahead of such a diagnosis? I mean, it truly is a diagnosis. How do we proactively approach people to avoid becoming burned out? And what we know from data is students and residents, that burnout can happen early. There may be many of you out there that are already feeling symptoms of exhaustion or fatigue or feeling depersonalized. And I hope you also feel inspired throughout this to recognize it in yourself and ask for ways that things can be improved or you can improve. So I just want to set that tone before we jump in. So first and foremost, hopefully this model is a little familiar to all of you. I know you've had a couple of speakers join you, in particular, Dr. Tracy Gaudette and Dr. Ben Kliegler, who have been real leaders in this work outside VA and in VA, with Dr. Kliegler now being our executive director for our Office of Patient-Centered Care and Cultural Transformation. So hopefully this model is really familiar, but let me break it down a little bit for you again. What is really fundamental to this model is the idea that we can't all have the kinds of rich conversations, empowerment, coaching, activation type conversations within our very small window of clinical time with our patients, right? I mean, I barely get 5 or 10 minutes with somebody before I have to move to the next room. For all of you in family practice out there, you get a little bit more time, but it's not a whole lot. It's not a lot to actually have those kinds of conversations. And yet, how do we change from a disease-based thinking model to one that's patient-centered, right? And so if we can make that switch, we have to also think about where do we have these conversations? And the whole health model attempts to say, patients don't only need to have clinical visits, they can have visits throughout their journey, throughout their lifespan, in their community, in the healthcare system, and still be working on their health and well-being. So really what's important is to then look at what that model will look like. And this becomes important when we think about employees as well. So let me focus your attention on the pathway. To me, I think this is the most exciting part of the model. This is where we allow people the space and time to think about what motivates them, where they feel that intrinsic feeling and sense of connection. Deeply embedded in this is the exploration of what we term mission, aspiration, and purpose. And the reason we use those words in VA is because we have veterans, obviously, who are really driven by their past military experience. And that helps them stay a little bit grounded in thinking about purpose. But maybe for all of us, what's even easier to think about is really what are our meanings? What is our value? And what is our purpose within this work, within our lives, within the bigger picture? And it's a big question. We don't often stop to ask ourselves that. And certainly, I can tell you throughout my career, when you're moving from every level of education to the next level of education, there's really not a whole lot of time sometimes to stop and have those reflections. But what happens when you do that and allow space for people to do that is you're now letting them determine their path forward. It's not necessarily us saying, we want you to do this movement, this exercise, this change in your diet. We want you to take these medications. All of that is true, and all of that is our medical expertise that we bring to the field. But we want the person in front of us to feel like they are deciding what is going to work for them. So this is really the heart of shared decision-making and then shared goal setting. And that can't happen unless we allow space for somebody to really think about what matters to them. In VA, that's driven by interaction with their own peers, their fellow veterans in a trusted environment. For employees, it's driven by camaraderie amongst each other. How can we sit and talk with each other about where we want our lives to go? And I've seen firsthand how powerful that can be. People start sharing things that they don't often share with clinicians. And I think importantly, this doesn't have to happen during the clinical visit. It can absolutely happen out at the YMCA, out at community centers. But no matter what, it is a part of the health model we're envisioning. And then what comes after that is once you've actually identified what matters to you and where you want to work on your health and well-being, then we give you the tools and the skills to really equip yourself. So that bottom left circle, this is where you're starting to practice techniques like meditation. You're starting to practice techniques around healthy eating and movement, adaptive type movement exercises. This is where you're getting education on sleep and stress. And all of these things are only helpful if we are connecting them back to what matters to us. So I keep driving home that point because you'll see that we've translated this model to employees, but we can't lose sight that we can throw a million resources at everybody. I'm sure you guys have had a lot of resources shared with you over these last 2 years, but it's not effective if you're not connecting that back to what matters to you. Each of you are individuals, and if one of you wants to work on sleep because that's disrupted, there's a different set of tools that will work for you versus somebody that may want to work on their relationships. And so that brings me to the heart of this model and this way of thinking, which is really these areas of self-care. And at the center of this is asking yourself this question: how do I shift from thinking all the time about what is the matter with me, what's the matter around me, to what matters to me? And you'll see as I talk about this more this hour, we tend to find ourselves in a place of recognizing the dangers. As human beings, we're inherently set up to think about the risks. What's going to go wrong? What's going to go wrong with this patient? What's going to go wrong with the system? What am I not doing well? We'll talk a little bit about that, how hard we can be on ourselves. And so really taking the time to shift from this place of risk mitigation to proactive thinking about what really matters to me. And around this circle, where do I want to focus my attention? So this is really where the empowerment comes from, allowing people space and time to look at each one of these areas and ask themselves, where am I and where would I like to be? So for all of you out there now, I'd love if you can put in the chat box, just quick as you look at this graphic, what speaks out to you as an area that you are both strong at and one that you would like to work on. I'll let you guys look at the graphic just for a few seconds and then type in the chat box first thing that comes to your mind. We have a personal health inventory that allows people to spend some time thinking about each one of these circles. And it absolutely is the heart of our journey as employees, being able to recognize that. Okay, great. So we've seen some comments coming in: family, friends, coworkers, sleep and refresh. Absolutely, keep them coming because this is good at you as a community to also see what's important to each other. All right, so as those are coming in, I'm seeing a lot of people talking about moving the body, sleep, personal development. Excellent. It really is that self-exploration and giving your space to think about that is what is so powerful. So as we think about taking that model and bringing it to employees, I will tell you that always, as we developed this shift to patient-centered care, we knew and know it's a cultural transformation, which means it will take time and it will take this camaraderie, this group of people coming together, and we can't do it alone. And so as we thought about rolling out this transformation, we knew that we had to give the experience to the employees. Each one of you needs to understand what it feels like to apply this kind of thinking to yourself, feel empowered around your well-being, and then bring that to the people you care for, right? And so as we developed our focus areas for the employee side of this transformation, we knew that we needed to focus on collaboration. And what do I mean by that? In VA, and maybe in your organization as well, we have so many people that care deeply about the employee experience, well-being, burnout, and everybody. There's a tendency for us to work so hard in one direction. We can be in parallel, we can be siloed, we can be duplicating efforts. And so we wanted to make sure that we were drawing attention to that collaboration first and foremost. The second thing is that you can't just build programming for employees like you can for the patients you care for, right? We can't necessarily leave the healthcare setting to go to the YMCA and take a class and come back. We can't even necessarily leave our clinic to go to a class on well-being because the days are so busy. So when we talked about bringing the experience of whole health to everybody, we really wanted to think about system redesign. How do you take your day, your morning huddles, your team meetings, your lunch breaks? How do you take those, and even bathroom breaks, quite honestly, I can say that as an ER doctor. How do you take those little moments and include ways of self-reflection, self-awareness, and well-being in those moments? And then the third and probably most critical is how are we continuously evaluating the value of implementing employee-facing efforts? The bottom line is you can do a lot of this work. There's a moral and ethical case for doing this work. But if we don't also measure the return on investing in this type of work, it doesn't keep this effort sustainable. So that is a big part of our strategic focus. So I want to share with you, I know this is a little data heavy, but I think important as you are all out there thinking about how do I develop structure to help employees. In the VA, which is a massive organization, we have over 140 medical centers. And we knew in order to get some traction on cultural transformation over the years, we would need to incentivize these centers to create some structure. And so what we focused on in fiscal year 21 was helping each medical center within our 18 networks develop and name an employee whole health coordinator or point of contact, provide an experience for introduction to whole health, so the ability to really think around that circle of health, and then create these collaborative committees that weren't just work groups, right? So the work groups are a great place to start the innovation and creativity. But when you want to move to action, those really need to be connected to your leaders. So you can share with them what you need, and they can share with you what the resources are to support you. So we had tremendous success in fiscal year 21 of bringing almost all 18 networks to the place where they have these three characteristics. And so we consider that really successful in the early stages of developing infrastructure. To guide us in this journey, we also have what's called a designation framework. It's a way for us to understand how each facility is moving along in implementation. And so I wanted to just share with you all, as you think about supporting the well-being of your teams, your clinics, your centers, it's really good to set the vision of where you want to be and what you want the culture to look like, and then the milestones that get you there. And we're happy to share this designation framework as it really pieces out what are the things we need to actually bring our institution to a place where this is the description of what's happening, that every employee is connecting to their meaning and purpose, that they have access to well-being type support systems within their actual workflow, that leaders understand the importance of investing in employees, and that we're really centered around these strategic focus areas. So I always like to start off with the vision of where we're trying to get. So when we look back on what we've done so far, let me just spend a few minutes telling you that these are not just ideas, right? We've actually seen some promising results from the work that we've done thus far. So when I talked about the whole health model itself, there were 18 flagship sites, one in each of the networks in VA, that in 2017 really started on this journey to implementing this model throughout the facilities. And for all of you residents and students out there, I mean, I know this firsthand. When you're working with people, you want so much for them to feel engaged and activated around their care. I mean, I would even argue some of the frustration that happens over our time in healthcare is that we work so hard to try to help people get to this state of activation and motivation. And it can be extremely frustrating when it feels like they are not. And there's a lot of reasons why they are not, and we'll talk a little bit about that. But it can feel sometimes like a failure, even for ourselves, when it shouldn't, right? It's not our suffering, it is their journey. And so what is empowering and what is exciting about the results I'm sharing here is that the whole health model is really helping veterans feel like they're receiving patient-centered care, feeling more engaged in their care, feeling like they're connecting to their meaning and purpose, and even some improvements in perceived stress. So these were some of the preliminary outcomes we saw from our flagship study. And we actually saw the business case too, right? People using less opioids compared to those that were not engaging in whole health, dramatic decrease, 38% compared to 11%. So very exciting outcomes that both help the veteran, but also all of you as healthcare providers that are providing the care. And so when we looked at employees who were delivering whole health to their veterans, noted that they were having less intention to turn over, rating their institution as a better place to work, feeling lower burnout and greater motivation. And we saw some early connections to some of our rating scales for facilities. All of this is very early, and then invites us to do a deeper analysis of how this is affecting employees and veterans. I just want to share from our all-employee survey. Again, for the second year, we're seeing a strong correlation between involvement in delivering this type of care, personalized whole health care, and their job attitudes, as I mentioned. And then we took this one step further this past year, and we asked, for those employees that are actually doing employee whole health for themselves, do we see a correlation to an improvement in some of these job attitudes? And you can see here that we do see some slight improvements. Again, we have to dive deeper to understand what it is people are doing, compare this again to groups that are not, but it's extremely exciting to us to see that that investment in self may be contributing to some of their improvement in their own well-being. And finally, this last year, we really focused on a qualitative evaluation of our efforts. And I think this is important for all of you out there as students, residents, leaders, practicing clinicians. What are the things we need to do to make the employee efforts more front-facing? And you can read through these. I'll point out a couple. When you think about creating any kind of transformation, leadership support and sponsorship and buy-in is critical. So as we think about developing our teams, our clinics, our facilities, how do we make sure those mentors and leaders feel fully invested? And then start to identify champions. Let me just say a word about that. When I say champions, it could be any one of you in your area. When there's somebody that actually cares about reminding people, bringing this kind of information to people during the workday, we see a lot more efforts on the part of the team. And then ensuring that there's a culture that's supportive of employee whole health. I really should highlight this one. It really comes down to continually bringing back our awareness to how much we need to invest in well-being. So let's talk about that. And I'm going to spend most of my time talking about what goes into promoting that culture of well-being. I mentioned to you at the beginning of the call that this talk would not be primarily focused on burnout, and yet the work we do here will inherently help burnout mitigation over time. But I also want to be clear that creating this culture of well-being is not about any one of you individuals only changing. Although it's foundational, it is also a systems level issue. So let me just say that again, right? Let's acknowledge burnout, true burnout, is rooted in organizational and system level drivers that need to change. So this is where all of you out there may be thinking about your workflows, your documentation, your time, your leave, all of these areas, your hiring processes, all of these areas are what impact us and absolutely must be a part of the equation. So at an organization level, I'll share with you some of the things we're doing. And then we come to the facility level where leadership and sponsorship really becomes important. But I would argue that a lot of the work we can do in the culture of well-being actually happens at the team level. This is where you really know your family, where you can make changes together, where you can start to create safety. And then foundational to that culture of well-being is how each one of you as an individual embodies this notion of health and well-being. So let's talk a little bit about what VA is doing. So we recognize that within the VA system, burnout is of deep concern, especially in these last 2 years of the pandemic. And again, by burnout, I mean really feeling those symptoms across exhaustion, depersonalization, and a lower sense of personal achievement. And so we have created this task force under the leadership of Dr. Mark Upton, who sits on the National Academy of Medicine Clinician Collaborative for Resilience, Dr. Marcia Lysot, who's a nurse executive in Greater LA, and Jessica Bongiorni, who's the chief for workforce management. And I give you their roles because I want you to see the kind of collaboration that needs to happen to make these kinds of initiatives work. Under that task force, we have lanes that are dedicated to the organizational drivers of burnout, and then our own well-being and leadership. So I wanted you to see some of the structure that's being built at the top, and all of this is being envisioned and enacted through field feedback. So we would, for example, we have clinicians that sit on every level of this task force. This is a real opportunity to invite the voice of the students, the residents, the practitioners, the leaders, so we can understand where the issues are happening at every level of the organization. And if We are very inspired by so many models that are happening outside VA, and absolutely take the wisdom of their work and try to adapt it to our environment. And so as you look at the task force that we created, it very much is similar to the type of culture for professional fulfillment that the Stanford model has pushed forward and AMA has supported. And this is the idea that in order to have professional fulfillment, we need to look across 3 areas. Number 1, our culture of well-being. This is really where leaders are impactful. Number 2, the efficiency of how we practice. This is the hard part. This again goes back to what are some of the drivers around me that I can improve over time to help my well-being. And then the 3rd is our personal resilience. But note the comment that I make here. The single biggest driver of personal satisfaction for people is the behavior of each individual's immediate leader. So think about that. Why I stay in an organization is often directly related to the type of leaders I have around me. And the second thing I want to point out is we're deeply inspired by the work that many organizations are doing around measuring the culture of well-being. So for all of you out there now reading this, just reflect for yourself as you read these questions. How would you answer these? How would you answer these questions for yourself, for your teams, within your organization? And I will note that this scale is shared with us from Dr. Melnick, who leads the team at Ohio State University. They are doing incredible work around employee well-being, and highly encourage you all to look at some of their documents in the actual activities that they're providing to their employees. We are actually working on bringing some of these types of questions into our all-employee survey as well, in an effort to really understand, how do you all feel about the organization when it comes to well-being? So I want to take some time and focus here on this slide, and then really spend the bulk of the talk looking at each one of these 5 behaviors. First, I want to just suggest that when I use that word leader, it is a big word in that it embodies most of us. I don't mean this as a leader as only somebody with a formal title. I am also thinking about those people in your work area, your team, that you deeply trust, that are your mentors, that may not have an official title. They may not be director or CEO or lead, but they still are leaders. And each one of you as students and residents, you are leaders. You are emerging leaders, if not already in formal leadership roles. So I hope you take heart of that and think about some of the tactics here that we are trying to really bring to our own employees and leaders within VA. So the 5 behaviors are based on, really this is from Mayo Foundation, but I think are really nice and simple and a great way to think about your day and your work. And the 5 behaviors are to include, inform, inquire, develop, and recognize. And so as you're reading the subtext for each one of these, I'll just point out to you, within VA, we are resource rich when it comes to offerings for leaders. The issues, though, are that we have to actually bring this type of training down to our grassroots level. And people are busy. People are so busy, there's not a lot of time to actually engage in trainings. So how do you do it when you barely have 5 minutes, right? I'm sure there's many of you out there that sometimes wonder how you even fit lunch into your day. And so we're really thinking about dosing this. And that can happen through mentorship and coaching. If there's one big tactic I can say, find your mentors, seek out mentors, ask for them to help you informally or formally, engage in coaching, and we'll talk a little bit about that. But we also want to think about how we train up our leaders formally. And that includes things like change management, actual leadership models. For us in VA, it's servant leadership. We have several podcasts and series people can tune into. And then, of course, probably the hardest thing, but the most important thing, is soliciting for feedback. How am I doing? Is there something I can improve? Is there something that I'm doing that's good that I can scale up? Really finding ways to make yourself comfortable with seeking that feedback will help your growth over time. And that has been one of the hardest things for me, right? Because sometimes when you hear feedback, you take it as a sense of, I might not have succeeded, I might have failed. We're not always the greatest at self-compassion, and I'll talk a little bit about that in just a minute. So really learning how to welcome that feedback starts to help you grow as a leader. So how do we do that? How do we grow and start to understand ourselves in these areas? I just want to let you know that our National Center for Organizational Development has really been promoting leadership coaching for many years. And it's something to consider in your lives and your organization as well. You may be doing this already, but coaching is an opportunity to understand where your areas of insecurities might be, where you want to grow, where you want to focus, how you want to aspire, and it sets your course with intention. And so I think it's very powerful. It's something that I have done in my own career, and I would highly encourage you to think about professional coaching. In fact, when we think about burnout mitigation, professional coaching is one of the things that comes up quite a bit. People want to think about their own professional growth. So let's break down each one of these leadership behaviors and talk a little bit about what VA is doing and what you all can do as well. So when we talk about include, that is about creating safety so that people feel they can voice their opinions. So within VA, we feel deeply committed to diversity, equity, and inclusion. And over these past couple of years, that growth has really happened tremendously. You can see at the top, we talked about our whole health model of care. Each one of you pointed out areas that are of importance to you. But when you actually look deeper, what are the social, structural, and systemic determinants under there that either help us succeed or maybe are challenges to us being able to live the way we want to in those areas? This is just as much true for our veterans that we care for, the people that you care for every day, as it is to us as employees. Do we have access to food, to safety in our neighborhoods, to a place that we can move? Do we have safe relationships? Do we feel connected to our purpose? Do we have resources to help with our stress management and power of the mind? And this is a deep concept, right? But we're trying to work very hard at bringing this type of awareness and education into our trainings. We've actually just redone the personal health inventory in an effort to bring these concepts more front and center. So it's really a challenge to all of us. And I would ask all of you, how are we thinking about these concepts in our educational material, in the way we talk with our patients, in the way we talk with each other, to really challenge our inherent biases and to be more inclusive and diverse in our opinions within our teams. The second thing that I think is very important within VHA to create that inclusivity is our work around high reliability organizations. And so for all of you, this is a big initiative out there, and it can sometimes be hard to balance all these things that are happening at the same time. But think about this as a student, as a resident, as a practitioner. We can't actually share what we think we want to see as the future state of our team or our workplace if we don't feel safe, if we don't feel that we are able to share when something is going wrong, or share when something's going right. How do we get to this place where we're minimizing harm, improving safety, and supporting the resiliency of our workforce unless we create that psychological safety? And so in VA, we're very committed to bringing this type of thinking to get to a high reliability organization. And it includes training in just culture, being able to feel like you can bring forward issues when they happen with safety, and that there will be some accountability for what you share. And this is a work in progress. I think it's one of the hardest things to create that safety because that can be challenged in so many ways. When teams are busy, when there feels like there's sort of hierarchical leadership, when it feels like you don't have the trust of the team, you can often feel like you don't want to share. And so working a lot on this feeling of inclusivity can create that environment where you feel like you actually want to engage and be a part of the solutions, which then contributes to your own resilience and well-being. When we look at the leadership behavior of informing, I want to point your attention to a great article from Shapiro et al. In the American Journal of Medicine. Many of you may have seen this, but I think worth pointing out. They try to look at well-being from a Maslow's hierarchy standpoint, in that we have basic needs that all of us need to meet. And I would even tell you from an ER standpoint, this is something that is really critical to us. Are we working in an emergency room that is safe from physical and verbal abuse? Do we have safety in seeking out resources for food and water, restrooms? These are really foundational, right? If we don't actually have that foundation, it becomes very hard to layer on some of the other well-being initiatives. So I ask all of you out there, as you're looking at this, Do you feel that you have some of the basics and the safety met? And if not, do you feel safe and engaged to be able to share that with your team? Because this is critical to your own well-being and all of our well-being. And I would argue when COVID hit some of our centers in full force, I mean, I know our hospitals right now in St. Louis are full, and we're boarding patients again. So when you think about this, do you feel during the pandemic that some of these were compromised? I know we had several facilities who felt like they just needed to have food and water to be able to work the many hours they were working. And it's fatiguing and tiring, and we really want to acknowledge that. And so tactically, as we think about what we can do at each layer of this pyramid, there's many things we can do proactively. I just want to point out a couple since we're thinking about the behavior skill of informing teams, is that we really want to be transparent about what is happening and what is not happening, and the reasons why we may not have resources. For some of you, you may be working in teams wondering why we don't have more staffing or more resources. And so it's important for leaders to say and be able to share, it's coming, we're working on it, we're competing with other areas for resources right now. What are the resources we need that we absolutely need to fight for? This transparency helps keep people engaged and contributes to the well-being of employees. And then under respect, I think it's really important that if we share ideas, they're heard, even if that idea cannot be implemented right away. But that constant dialogue and sharing and that empowerment, allowing people to bring forward what they think is important, is really what we're trying to get to. And then the visibility of leaders in the actual area that you work so you can share your ideas. That all contributes to teams staying informed. So some nice tactics to think about in your own environment. As we think about inquiring, we have something that we've been scaling up here. You all may have something similar in your areas. And I wonder how many of you as students and residents have been involved in these kinds of activities where you're thinking about process improvements in your own area, thinking about creative solutions, innovative solutions to issues that you face day to day. We really want to get people feeling more empowered, not feeling like they have to wait for somebody else to help them in their solutions. And so two physicians in San Diego, Dr. Jenny Way and Simone Cantor, have been deeply influenced by Mayo Clinic's strategies and have implemented something called Listen, Sort, Empower in their teams. And this is really cool, right? Because they don't need to wait for higher level leadership to do anything. This is really about their own clinics and teams talking together, creating camaraderie, having time to think about, okay, what are the issues with our workflow, with our education, with our training, with our environment that we can actually work on and fix. These work units were given some time to understand how to bring that safety, identify those pebbles, and then learn skills to be able to solve some of those issues. Clearly, what they learned is that work units need time really to be able to do this, and need committed sponsorship and leaders that support them in doing this work. And where they've done that, they've actually seen their metrics improve. If you look at the second paragraph, that their organizational metric for best place to work improved from 65 to 85%. And their percentage of disengaged staff significantly went down. These are primary care providers, which has been a very difficult area for us through all of the pandemic. So I think just a case in point, a way to really inquire and understand what your teams are feeling. But what the heart of this inquire piece really is in our mind is coming back again to this well-being idea on an individual level. And when we talked at the beginning of this call, we talked about self-awareness and mindful presence to be able to understand where you are in each one of these areas and where you want to be. But I also want us to think about our values, our purpose, and then the bigger concept of self-compassion. So let's talk about these all a little bit more. When you hear that word mindfulness, and I'd love to see in the chat box how many of you have either a formal or informal practice that helps you with your own well-being. Just type in the box if you're doing something for that now, whether it be meditation, mindfulness, or some other practice that helps you for your own well-being. I want to tell you that in my own practice, I learned about mindfulness many, many years ago, but I don't think I ever fully understood the power of what that really meant and continually learn. So I love this understanding of it. It helps us put some space between ourselves and our thoughts. It helps us to practice breaking down our habitual thoughts and responses. And why is that important? We actually look at how the brain works. So this is beautiful. I love seeing the comments. So many of you have daily practices to help your own well-being. This is really important because physiologically, if we look at the anatomy of our brain and how it functions, we're chemically wired to be able to react to situations. Again, this is really about our need to make sure dangers around us are not going to hurt us. But it's so much so that we're wired to react. And you can see the different parts of our brain that really go into making those reactions happen. And what mindful awareness or any of the things that you're bringing up that allow you to pause, what does that do? It helps us stop and think about our emotional reactions. So it gives us that a chance to have emotional regulation. And so the idea is, if I'm in the ER and somebody is interacting with me in perhaps a negative way, in the past, I would take that home personally. I would see it as this person is mad that I didn't provide something quick enough, fast enough in the way that they wanted. I didn't give them the cure that they wanted in the case of chronic pain. So much of that represents moral distress that I had been feeling throughout the years. But it wasn't until I really connected with this concept of pausing and noticing and choosing that I became aware that it's really the person in front of me that's going through the suffering. And they don't maybe have the skills to talk, to cope, to communicate on what they're feeling. And so then me in this moment, I'm the recipient of that suffering. That's true. But it is not that they're saying to me, I'm a failure, right? And I think early on in our careers, we start to learn some of these concepts that if we don't do something perfect, if we don't do it right the first time, we somehow have failed. And that's just an unrealistic expectation of any of us. Really, what we need to understand is that failures happen. We need to feel safe enough to talk about them, to think about how we can improve the next time, and to really see it as wisdom and growth, and to welcome the opportunities to talk about the mistakes we make. And that only happens, all of this only happens when we have that fundamental skill of creating space between our reactions and what actually happened. So a challenge for all of you out there is the next time you find yourself in a situation where something didn't go exactly how you wanted it. Maybe a patient is unhappy with something that happened. Maybe you actually did make an error in something that you're doing, and you're trying to understand how to fix that. I want us all to take a moment and practice that skill of pausing and noticing and choosing how we react. And the reason that's important to me is when we look at the literature around burnout, especially in the medical profession, there's a lot of things we do well. I mean, look at the chat box. All of you have tremendous skills in taking care of your individual well-being. But one thing we consistently rank low on is self-compassion. And so I want to challenge all of us, even today and tomorrow, when you find yourself saying, man, I really messed up. I really screwed up. This is really not going the way I want. To stop and pause and notice and be kinder to ourselves in that moment. Say, it's okay. Things like this happen. I'm going to reach out and talk about what happened and how I can do it better next time. And I'm going to make that break in how I beat myself up and move forward. And that skill over time actually helps support our well-being tremendously. And we're really working on this concept within employee whole health. And so I point out this study because I'm always trying to find what are the protective pieces to our own well-being. And so it's interesting, right? We can all have very different subtypes when it comes to feeling burned out. Some of us always working a lot of tasks, some of us working on things that don't feel challenging, and some of us feeling really disconnected or worn out to our work. But no matter what the type is, all of them have negative self-compassion dimensions. And so this really points out that we need to cultivate that practice as a team, whether that's through scripts, gratitude practices, actually doing what I had just mentioned about pausing and noticing and choosing. Let's spend some time building that skill now early in your careers because it will serve you well over time. All of this, the ability to look at your whole health, what you value and your purpose, the ability to pause and reflect on what you're feeling in this moment, lead me to this slide, which is that if we don't actually spend the time doing that, we will find ourselves in the orange and red parts of this graphic and not know how we got there. And I will tell you, I won't make any of you share out loud, but please look at this. And if you are feeling that you are in one of these areas on the orange and red, please know that it is right to reach out for help. It is right to ask for support. We are also not well trained in the medical world, or at least I wasn't, to ask for help. And yet asking for help is incredibly courageous, and it's something we are promoting heavily in VA. Asking for help is a part of what we should do in the medical profession, not keep it bottled up. And so through our whole health work, we provide many opportunities for people to think about their well-being, hopefully being able to course correct and bring themselves back to the green and yellow areas. And I also point out some of the words that maybe need to become a part of our language so that we can recognize them and move through them. So in this work that we do, it's very interesting that we may not know that we are suffering from some of these occupational stresses. And then you can find yourself in a state of burnout because we've passed through some of these other areas and not known it. So I talked to you a little bit about my own experience in the ER and sort of years of feeling these micro distresses that I didn't know what the term was for them, but truthfully, they were moral distress. I wanted to do the right thing for the patient, but the system didn't allow it. I wanted to transfer somebody that was a trauma patient to a center, but there were no beds at that trauma center. Therefore, they had to be managed in a center that didn't have access to all the resources it needed. And I can tell you story after story, but for the sake of time, I'll just share. If you're feeling in a moment sort of that tug of, gosh, I just feel like I can't do the right thing even though I want to, that is really something interfacing with your own values, with your own morals. And it's important to recognize that distress, name it, and share it, even if that's in peer support, a camaraderie group that you all create. We call something battle buddies, where you find somebody you can share it with, and that's who keeps checking in on you. Understanding moral distress going into moral injury is very important. The other thing is that as we hear the stories of the people we care for, there's often a tendency to take on that trauma and we become second victims ourselves. So really understanding how to deliver trauma-informed care, understanding how to use mindfulness to separate what that person is feeling from what you take home is important for your own well-being as well. So let me give you an example. If you're taking care of a patient that has a metastatic cancer diagnosis, naturally our minds go to, this is incredibly painful. There's a lot of suffering. What if my mother or father had that same diagnosis? What if my child had that diagnosis? And thereby we internalize some of the trauma this person is going to. We become traumatized in listening. How do we create that separation? Again, how do we pause in that moment and notice, wait a second, I'm starting to bring some of those emotions and project them to my own self. Let me bring myself back to the present state and listen to this person's journey. But all of these take skill building over time. And I think the deeper an organization's commitment is to helping people name what they're feeling, move through it, and proactively develop skills to be able to counter that when it happens, are all a part of the employee whole health work we're doing in VA. So let me give you some examples of the innovation happening across our center, and maybe we'll give you ideas in your own workforce that you can do. I mentioned Battle Buddies, that's at the bottom right. We can share any of these documents with you. This is a standard operating document that helps people develop this within their own teams and sites. And essentially, like I said, it's somebody that partners with you and can have your back, essentially. You know, I'm noticing that you look tired these last few days. What's going on? Do you need any help? I'm noticing that you seem more short with the staff around you. What's going on? Let me know how I can help you with that. That's really needed right now for each of us. We have a offering through our National Center for PTSD called Stress First Aid. This really trains people to recognize the signs of stress and burnout that are happening and intervene early. We have a group in Salisbury who developed Operation Stress Control. And as you can see, it really was a part of our incident response center for COVID. And what they built in there was an actual traumatic event management team made up of mental health, social work, chaplain, and EAP, which is our employee assistance program. And then at the top left, we have peer support for employees. This is the idea that each one of us can support somebody that is going through a difficult time. You don't need to wait until years later to talk about this. If you had a rough case, if you had something that happened in your day, that made you feel like something went wrong, a patient had a bad outcome, or I think I did something wrong, seeking out that peer support to talk through it, which is your own colleague. Talk through it. That person helps with the self-compassion piece, helps you think proactively about what you can do better next time. It really moves the intervention from postvention to presentvention. And the data will show is it allows us to more easily move past it and be more productive. So let me just quickly move through some of these slides as I know I'm running low on time. But as we think about developing, we're really looking at moving people from this transactional leadership model to transformational leadership. So each one of you, as you think about your own growth, thinking about how we move from being reactive and moving to proactive, thinking about well-being, thinking about how we create solutions together. We talked about a lot of this, but it is a really big part of our VA culture. And specifically, we talked a lot about this as well. When we think about envisioning well-being, it's bigger than just any one approach. It's not just yoga or just meditation. I want you all to be thinking, how do I think about my own values, my own purpose? How do I reach out for help professionally when I need it? And how do I think about community? And so I have a lot of slides here that are showing you how we move through it in VA. We definitely want to help people think about whole health introduction and then move through thinking about taking charge of their own life and then their skill building. But let me move to actually talking about health coaching, because I know we're a bit short on time, and then I'll let you guys share the resources after. Health coaching is an attempt for us to move people from feeling like they have a locus of control that's outside them to one that's internal. And it's important because it moves us from thinking about how we have to fix everything to how we can partner on a journey together. So it helps patients that way, and it can help us as well as employees. Our coaching process follows the same whole health model in that we think about our mission and purpose. We think about the areas we want to focus on and how we can execute a plan for ourselves. And the data is behind it. In this health coaching study in particular, we saw over 2,000 individuals engaging in health coaching and a significant decrease in their total number of unhealthy days. Highly encourage every one of you out there, especially as you're emerging in your careers, to think about professional and personal coaching. And the reason is we did a pilot with about 49 people in the Bronx during COVID. And this is really important to me, and I'm going to just jump to the results here. Statistically significant results in reducing stress and improving resiliency in the cohort that went through only 4 sessions of coaching. So really remarkable results in just a short period of time. And this is what they were saying: give me more. Don't make this go away. I need more than 6 sessions. I need it to be around me all the time. And these people were in the Bronx in the middle of New York's worst COVID pandemic, right? The first surge. And this is what we were hearing. So to me, it's remarkable. And so let me tell you, as we go through here and think about recognizing, okay, the final behavior, I want to share this article with you. I hope you can all take a look at it later. One of the biggest things from this article that I thought was really moving to me as we think about recognizing each other is that when you look at what employees really want, the top left light blue area, and what employers thought employees wanted, there's a bit of a disconnect there. But what was most important in that top left is people wanted to feel valued by their teams and a sense of belonging. So if I can leave you with one thing as I quickly go through resources, it is that we have to find ways to show each other appreciation and gratitude. It helps the self-compassion piece. It helps our own well-being while we're trying to work on system issues. Here's just an example of a gratitude app. VA put out thousands of uses over this last year. Something you can definitely emulate in your own sites. But even a simple email will do wonders. On the horizon for us is a Chief Wellbeing Officer pilot. I can talk more about this at another time with any of you that are interested, but we're really trying to elevate our work and create leadership level roles at every facility that work on this kind of well-being effort. We're actually even looking at protecting the time of employees to do self-care. This is always a big deal. And our results in the 6-month period do show some small improvements in stress resiliency and the culture of well-being. So something to think about. How do you protect your time? And then finally, I want to leave you guys with the Live Whole Health app. I have several more resources to share with you. All can be shared outside the VA, and I'll let your team share the slide set so we can take some questions here at the end. But definitely scan the QR code if you'd like. This is a great way to end in a way that you guys can use the app to think about your own well-being and how you bring this to your own areas. So with that, Kara, I know I have a few more slides, but they can easily be shared after the call. So we'll take some questions if that's all right.
Amazing. Thank you so much, Dr. Reddy. If anybody has questions, raise your hand. Do you want to stop sharing your screen, Dr.
Oh,
Reddy?
yeah, I can do that. That might be easier. There you go.
Perfect. Easier
Okay.
to or type it in the chat.
Yeah, I can see your questions in the chat if you have them there as well.
It looks like Dr. Westervelt has a question.
Dr. Reddy, that was an amazing talk. Thank you. Thank you for the inspiration and all that you're doing at the VA. I'm wondering if you can talk just a little bit. I was very interested in, as you started talking at the very end there about the protected time.
Yeah.
Can you talk a little bit about what you're doing with that and how that's working?
Yeah, my apologies. I think I ran out of time a little bit there. And so let me dive in a little deeper there. The number one thing we hear when we talk about employee well-being is, oh, well, if you just gave me more time, then I'd be able to do it, right? And so it's an interesting concept, right? Is this a perceived barrier or a real barrier? And so what we set off to do is look over the course of an entire 12 months and what would happen if we actually gave people an hour a week? Would they use it? How would they use it? And would it impact these well-being measures? And so we got union approval. We actually created a labor mapping code so it wouldn't impact productivity. And so the denominator changes, right, for clinicians. And what we find is it's incredibly hard for people to use the time. They don't want to let their colleagues down. They think their workload is high. They think their supervisor doesn't want them to leave. But there is a larger than half of the people that are signed up of that 312 are using it. And it's taken incredible change management to keep that front and center, keep reminding them of it. But when they do use it, we see statistically significant, albeit small, but still significant results in stress and resiliency at the 6-month evaluation. Now we'll be looking again at the final 12 months. But I really want to point out, we have 2 15-minute breaks a day and a 30-minute lunch allowed to us. And many people work through all of that. So just giving somebody the time is not enough. You need to create that leadership level presence that constantly brings that forward. Hey, you didn't take your break. You need to take that break. You didn't take that hour for self-care. I really want you to. It'll reset your mind. It's a good thing to do. So that's really why I wanted to spend so much time on culture. We can put a lot of tactics out there, but if the culture itself is not built to deploy those tactics, they often aren't used.
Thank you.
Denise has a great question. How important is addressing personal trauma and building capacity and competency in meeting outcome goals? It is hugely, hugely important. We're learning so much more about ACEs or adverse childhood experiences and how that impacts our own growth and development over time. This is really what whole health is about. It's about having that time for self-awareness and self-exploration so we understand how these traumas are impacting us in our current state, right? And so how do we build our resiliency skills, our coping skills, our ability to interact with people if we don't understand where we're coming from? So I think it's extremely important. And I will say our employees bring a lot of these past experiences to the table. It's a part of their determinants of health. And so that's where we're trying to invite not only the camaraderie groups, but we're looking at how we build an even stronger mental health support presence for our employees. So you're not just waiting for crisis. Our employee assistance program is often seen as an HR tool. We're trying to get ahead of that and be able to have mental health supports for just what you described, Denise, ahead of time.
We are right at time here. Amazing talk. Thank you. I think we could go on for a lot longer. So thank you everybody for coming, and thank you Dr. Reddy for joining us today. It was really amazing. And this talk will be posted on the UVM Integrative Health website if people want to go back and review some of the tools that Dr. Reddy shared with us.
Yeah, please do, because the very end of this is a lot of tools, resources, videos that you guys can all access outside VA. So I'm hoping you'll take some time to look at them. And it's a pleasure being with all of you, especially all of you students and residents that are starting your journeys. I'm just so very excited for all of you. So thank you for having me.
Thank you very much for being here. It was our pleasure. It was a great talk, and I think we've learned a lot from you today. And one thing that I was thinking about is that concept of leadership within your site, leadership within your small team, and how that can improve the well-being of the whole there. And so something I'm definitely going to take with me today. Thank you.
Yeah, empowering and equipping can happen at every level. Absolutely.
Thank you.
Thank you. Thanks, everyone. Bye.
Great day, everybody.